Dunn, 5 minutes.
Thank you very much, Mr. Chairman. Thank you, Secretary Becerra, for being here today. I have some questions specifically about a new program housed in ASPR. I'm excited about the mission of the Office of Industrial-Based Management and Supply Chains, though, to be frank, I have some concerns over ASPR's experience in executing on a program this size. So I want to highlight for you that Congress is watching. I think HHS needs to get this right and ensure that the focus remains on this critical need. I hope we can work together to make that a success. I believe in the shared goal of prioritizing U.S. investments in strengthening the domestic biomanufacturing industrial base, which makes us more resilient when future crises occur and enables us to surge production to meet demand for domestically produced medical supplies and products. This office aims to respond to critical lessons learned from COVID-19 pandemic. It'd be a disgrace for us to have to relearn all the same lessons again. I also want to support good-paying biomedical manufacturing jobs in the United States. So I think the creation of the Office of the Industrial-Based Management Supply Chain, IBMSC, was a part of the elevation of ASPR to an operating division of HHS. Now, as you know, that office was implemented using supplemental appropriations. It was tasked with that critical medical countermeasures like drugs, vaccines, and therapeutics are manufactured in the United States, or certainly friendshored, as it were. IBM MSC also aims to support innovative manufacturing technologies in the fill-finish capacities to better produce and distribute drug products and vaccines, et cetera. In your 25 budget, you requested $95 million at ASPR for the biodefense production of medical countermeasures and essential medicines, which would be managed by that office, as I understand. Correct? Okay, good. How is the new office of IBMSC within ASPR, how's it working to ensure these supplies are, in fact, manufactured here?
Congressman, first, appreciate the mention of the work that ASPR and BARDA are doing. And here I'm going to ask you for some help because this is what we're requesting. We don't know if we're going to get it. We haven't been getting the resources we need. We had a proposal to do domestic production last year and the year before, but we didn't get the funding to do it. How we would do it, BARDA, ASPR, they're ready to go. We've been doing some of this. COVID gave us the capabilities to do it. Our folks are raring to go. We have private sector partners who are raring to go because we would love nothing more than to know that the production of the most critical countermeasures that we need in case of a pandemic are accessible to us, and we don't have to go to China or anywhere else.
Yeah, I see if people approach us, or we have companies approach us all the time that are actually very, good American companies that are trying to manufacture and do that in America. So I think we can help them with that. Let me turn my attention to the IRA for a moment. The price part of that bill. So according to the Kaiser Family Foundation, the number of standalone drug plans is plummeting under this administration. It's down 29% since 2021, and it increased 34% under the Trump administration. So many analysts are actually predicting that the mass exodus of standalone drug plans in 2025 is going to leave Part D. That's when Part D redesign goes into effect, and it's going to leave these patients who take traditional Medicare no alternative for prescription drug coverage. So, it looks like our policy here is going to be to corral our seniors into HMOs that restrict their choices of physicians and treatments, or they don't get a drug plan coverage at all on CMS. Can you address that?
Yeah, I'd love to see what you're reading because that's not what I understand. What we're doing is making sure that drugs are actually going to go down in price.
Well, but the drug plans are going away. So the insurance plans for traditional Medicare, this is not the Medicare Advantage plans, the traditional Medicare, they will lack coverage.
Again, please share that.
I'm an old guy. This is a personal question.
But please share that information because that's not what I'm hearing.
Well, I'm quoting the industry at large.
Well,
Our time is running out.
I can understand the industry's trying to spook people, but I'm asking so I want to see the data myself instead of relying on industry generated data.
Turn around is fair play. You're asking us for a written response after that. Okay.
Within 30 days, okay?
We'll do it. Thank you very much. I yield back.
Gentleman yields back. Recognize Ms. Bergan for 5 5 minutes.
Thank you, Mr. Chairman. Thank you, Secretary.